Right ventricle.
No, we're not there yet. And then into the pulmonary capillaries, where it's creating fluid in the lungs. All right. So because of that fluid, what are unique signs and symptoms? Actually, let me back up. Sorry. All right. So eventually, that heart failure, because it's building up in the lungs, that fluid's building up in the lungs, eventually it's going to back up and affect the right ventricle. So CHF always starts on the left and then works its way to the right. So once we have the right ventricle failing, because remember, that's sending blood into the lungs. So once we start having backup on the right ventricle, where else do we have the backup to?
The right atrium as well.
Okay, then the right atrium, and then?
Superior and inferior vena cava.
All right. So we're going to start seeing the effect of the blood backing up on the outside. We see the inside. Well, we don't see it, but we could hear it. Because what are we going to hear when we listen to the lungs in a patient with left-sided CHF?
Would we hear a crackling?
There you go, crackles. Um, okay. So we have the crackles in the lungs. That's from the fluid that's there. What else? All right, let's see. All right. Did I answer the question somebody asked me? I don't remember. So what are the unique signs and symptoms of CHF?
Pedal edema.
Jugular vein distension?
And among, yes, the pulmonary edema is only for the left side of ventricular failure. Okay, JVD, what else?
So would irregular heartbeats be one since it's getting weak?
No?
Dyspnea.
What's orthopnea?
It says here that that's difficulty breathing while lying flat.
Okay, and why does that occur? Pechosita, porque no se resulta.
They have difficulty laying flat because of the fluid buildup. They're not able to take a breath.
No, they're able to take a breath.
I mean, it's difficult for them to get that gas exchange
But why?
because when you're standing, it's like gravity pulls everything down, and when you're laying down flat, it's a different circumstance.
How?
Because they're not Aquaman.
Okay. You're on the right path.
Because when they're laying flat, it pulls. It doesn't. It doesn't have gravity to pull it down.
Huh? There's a lung. Okay. And we have pulmonary edema. We have fluid in the lung. You remember the Aquaman thing. Okay. So there's the crackles. I told you what crackles sound like. Hello?
Yes.
Okay. So on the left, again, we got that fluid. So as I think it was Jesse mentioned, that we have the inability to breathe when laying down. That's because this person, the head's over here. That's a long neck. Okay. And so that fluid now, when the patient is laying down, what did we just do to that fluid? Did we shift that volume?
Yes.
Are we covering up more surface area?
Yes.
And so laying down, they're unable to breathe because that fluid is taking up more space within their chest or within their lung. And so what you'll see when you walk in is, Chihuahua. Well, you'll see is, so here's the bed. The box spring. Okay. And you got one pillow and two pillows and three pillows. And so the person like that, I can't breathe. Wait. They're sad. They can't breathe. That's what we call orthopnea. This is supposed to be an arm. And there's the other arm. They have to be sitting up. Actually, let's kind of adjust this a little bit. Wait, what? Oh, don't scare me like that. And I don't like him. So there's the orthopnea. You'll see them sitting up because they can't breathe. And that's exactly what happened to my dad when he had his heart attack. Or the other thing that you'll see, hey. The other thing you'll see is I can't draw a sofa. I'm trying to think how to draw a sofa. Green eyes this time. And chicken bread. Anybody ever hear that one?
I can bet, you can bet chicken breath.
Huh?
That's not how it goes?
No. But there was a nurse somewhere in the nursing home, when they were asked what was wrong with the patient, she said chicken bread. It's like, huh? She can't breathe. All right, so that's our thought, yeah, where they need to be sitting up in order to be able to breathe because of all that fluid that we have right up in there. Okay? So did that make sense? Did that help kind of explain it?
Yes.
And then I think your book has the cankles, the lady with the really swollen ankles.
Yes.
Okay. All right. What else? Anything else that's unique to CHF? Not really. So, as you can see here, so we have different conditions with unique features. Some will have more than others. But you notice, and some of them had cough, and some of them had severe fits of cough. But you notice how, at least this, the common signs and symptoms. Now, you guys were just like freaking spitballing it, just trying to see what would stick. You have to understand what's happening here. How are you going to be if you can't catch your breath? Are you going to be happy about it? Are you be throwing a party? Are
No.
you going to be anxious? Nervous? Because, and I think I've mentioned this to you guys before. Do you like breathing? Is it a habit you want to give up anytime soon? Nobody wants to give that up cold turkey?
No, sir.
No, you sure? So, you know, some of us have been doing it a long time. 25 years, 30 years, 35 years. We kind of like it. And so if you can't catch your breath, you're going to be anxious. And so are you going to be anxious with each one of these? Yeah, because you're having a hard time breathing, getting air into your lungs and being able to use that oxygen. We already talked about tachycardia, tachypnea, because of what happens when the body is trying to maintain homeostasis, when it's being hyperperfused. We know that the carbon dioxide levels build up. Now, emphysema, then it happens with asthma, but asthma, you have those expiratory wheezes because of the constricted bronchioles. But emphysema, the bronchioles aren't constricted. It's the alveoli that are trapping CO2. Different pathophysiology there. So with hyperperfusion, the body's trying to get rid of that extra carbon dioxide because we switched over to anaerobic metabolism where we're not using oxygen to create energy. Because like I said, that's why I showed you the picture at the beginning. Even those muscle fibers, they need that oxygen. And if they're not getting it, the body's going to know about it. I think we talked about this before. Yeah, we did in respiratory or not respiratory emergencies. When we did the human body, remember I said, if you were to listen right now with no one talking, would you be able to hear anybody breathing? No, right? It's effortless. It's quiet. You wouldn't see them breathing either, maybe except for chest expansion and going down, rise and fall. So it's effortless. It's when we start having noisy breathing, working hard to breathe, abdominal breathing, accessory muscle use. Oh, we forgot to put abdominal breathing somewhere. Accessory muscle use, nasal flaring, tripoding. All those are signs of the person that's working to breathe because it's needed. Okay. So some of these have similar treatments. Let me check on something real quick, and I guess you guys will be able to see it too, because I'm. It's the same lady. Yeah. Let's see what this lady has to say. How long is the video? What did you notice about her breathing?
I couldn't hear it.
Did I forget again?
So tell me what brings you in today.
Why am I in? Because my feet were swelling.
Your feet.
What'd you notice about her work of breathing?
She's having a hard time to catch a breath.
Okay. Kind of short sentences?
Yes, sir.
Okay.
Feet were all swollen, and can I see where your feet are swollen? Can you show me?
Before he removes the sock, do you see anything? Oh, this one looks worse than the other.
The skin, right?
Yeah, you see the stretching right here? This one, not so much, but you do see a little bit.
Yes, sir.
Okay.
She's got blisters. It looks
What
like
blisters?
like right above her sock.
Those aren't blisters. That's the sock pressing on her skin. And then you see over here by the index finger, how it kind of just falls off a little bit? Let's see. You see? It's just the wrinkle from the socks. So you see that big curve right there?
Yeah, but I've seen people that severe edema that have it.
I know. But I'm just saying, in this particular one, and yeah, I showed you guys a video where the feet were really, really ugly. But no, that's just the pressure of the socks on the skin because of the swelling. And again,
Here, just going down.
where the sock bent.
A pretty good bit.
Yeah, and so if we press here,
And you see how it stays indented? That's a sign of pedal edema. And we call that pitting edema. Pitting edema.
there's a little bit of swelling there.
You're not as bad as you were an hour ago.
And were you having any problems breathing today?
No,
Yes, you were.
they keep me on a,
Did you hear her cough?
Yeah.
Yes, sir.
Like there was a little rattling in there?
If you look closer, you can see her nose flare.
Mm-hmm. Now what's this funky thing in front of her? No idea?
No, sir. No, sir.
That measures her carbon dioxide levels. When she breathes out, this captures that carbon dioxide and it sends it to the machine and it interprets the carbon dioxide levels.
breathing machine.
Is she on BiPAP at home? Or CPAP? She's on an oxygen booster, and because I noticed that you're breathing a little bit fast right now.
She breathes short and shallow.
That's normal for her, but you've noticed.
She's had the trouble with it.
And how long have you noticed her breathing faster for?
Last week or so.
For a week or so? Any fever? Any vomiting?
No,
So what does the no fever tell us?
No infection or virus.
Okay, which means
No pneumonia.
no pneumonia.
Well, thank you for letting us take this video. We really appreciate it.
well, it better be good.
Too funny. Okay. So they have an EMS one? No. Oh, yeah. Although I don't like the chest pressure. Let's see what this one does. No, I take that back. Let's look at this one.
So, Cynthia, can you tell me why you called the ambulance today?
Because I have swelling from my feet all the way up into my chest and in my face. It hurts. My chest is hurting.
Okay. And how long has the swelling been going on?
About a week.
And did you see your doctor
Yes.
for that?
Yeah,
And
I did.
what did your doctor do for you?
She helped my Lasix.
Do you see all that swelling?
Yes, sir. Yes, sir.
Still indentation there. What do we call that again?
Pitting edema.
Pitting edema. Now, she just said something. I want you guys to take note of it.
For you.
She helped my Lasix
Okay. Do you know what the dosage?
that I'm taking.
Yes. What are you taking now?
I take 80 in the morning and 80 at night.
80 milligrams in the morning and 80 at night?
Yes.
Okay. And have you ever had CHF before? Congestive heart failure?
That's what they said I have.
Okay.
So
And Do you have any other medical problems?
Well, I'm a diabetic.
Okay, how long
Type
have you
2.
been a diabetic?
Since I was a kid.
Okay, do you take insulin for that?
Yes.
Okay.
I take metformin and I take insulin.
Okay. Do you take all your medicines as prescribed
Yes.
by the doctor? Okay.
Yes, I do.
And you saw your doctor, the swelling that we noted here on your feet, that's been going on for the better part of a week?
Yeah.
And the doctor increased your Lasix?
Yes.
And another heart medication, correct?
Yes.
Okay, thank you.
Okay. What medicine is she on?
Lasix.
Okay. And what does Lasix do? I know I talked about this.
That's a diuretic.
So someone other than Steve, what does that mean?
It's a water pill.
Okay, but what does it do? It gives you water? You don't have to drink water anymore, just take a pill? That's what they call it, but what does it do? What is the action of Lasix?
It helps to reduce.
Hold on.
Yeah.
Who was speaking? What female was speaking? Was it you, Jesse? No.
It was me.
Rakisha?
Yes.
Okay, so it does what?
It helps with swelling. So I don't know how to explain it, but it's like the water in your body when you swell up, it helps release that.
Okay. Women will take Lasix to lose water weight when they're trying to slim down. They'll take Lasix to lose that water weight. Yeah, it's a diuretic which makes you urinate. Instead of that fluid, that water. I'm gonna start ignoring all these messages. Helps eliminate salt from the body. Well, it does that too, but also potassium. It's not just salt, it's potassium as well, because you're urinating a lot. Basically, instead of reabsorbing the water, it lets it go down the kidneys, down your ureters, and you pee it out. And so it helps eliminate that excess water. Also, women that suffer severe PMS will be given diuretics, because usually what happens is they get bloated. So to prevent them from being more cranky than usual, they'll give them a diuretic. Ooh, no daggers were thrown my way. Cool. So Lasix, be on the lookout for Lasix if you suspect CHF. Okay. What else was I gonna go? All right, so let's get back to this here. All right. I didn't see an asthma one. So how are we gonna take care of? Actually, let me rephrase that. What are some of the questions you want to ask an asthmatic? Here's a hint. Is it a respiratory emergency? Yes. And so there's a set of questions that we ask respiratory emergency patients. Do you remember what they were? Here's a hint. It starts with O and ends with PQRST. What is OPQRST? In honor of Mr. Alex Trebek that died over the weekend, what is OPQRST?
Onset, provocation, radiation, severity,
And time. For respiratory, quality. What are we trying to determine with quality?
Severity.
No, that's an S.
How would you describe pain?
That's in chest. They might not be playing of chest pain though. Quality for respiratory emergencies is different. Here's where it's different. Is it easier to breathe in or breathe out? With an asthmatic, is it going to be easier to breathe in or breathe out? Man, Lou, why do you have to be so mean? Give us a simple question. Like, what's 1 + 1? Nope. I meant no to Ramon, not nope, like I'm not going to give you easy questions. So Ramon said out, and I said nope. So what's the answer?
In.
It's easier to breathe in. I'm shutting off my phone.
Me too.
That's fine. Just my phone keeps going off because everybody's typing in their answers. So if anybody has an emergency, tough shit. See, I already took my watch off a long time ago because it kept vibrating too. So quality, it's easier to breathe in. Remember, we're trying to push out the extra carbon dioxide so it's long or prolonged. Okay. What else with asthma? All right, so OPQRST. Oh, before I forget. There's Charlie. Still up at this hour? He's gonna be a party animal when he grows up. Whenever you have a respiratory emergency, you need to ask them if they're having any chest pain. Can you have chest pain with pneumonia?
Yes.
Yes, you can.
Yes.
Yeah.
And if the patient's having chest pain, you also want to have them if they're having any problems breathing. Now, if they say yes to either one, yes, trouble breathing, or yes, chest pain, the next question is, what came first? Was it the chest pain or was it the shortness of breath? Because if they have chest pain and they say the shortness of breath came first, could the pneumonia with all that coughing cause that chest pain?
Yes, sir.
Yes.
So that would follow under the T part for time.
No, that's just how long it's been going on for. I mean, you could put it on there if you want. But, oh, I forgot to introduce medical emergencies. All right. With medical emergencies, because this is a whole new section. Now this is really going to have you start to think. And even later on, when you start dealing with patients, if you respond to 911, or if you work a special event or anything like that, you need to start thinking what might be wrong with this patient. Medical emergencies, there's a lot of questions to ask, and wait till we get to abdominal emergencies. Medical emergencies, you have to be a detective. You have to ask questions. So all this, you guys typing in answers and all this other stuff, no, ask questions. Otherwise, you're not going to come up with a solution, or really, you're not going to come up with a problem. You know they have shortness of breath. All right, how are you going to take care of it? You don't give albuterol to CHF. You have to be a detective. Ask your questions and follow that path. And if you can't go any further, either A, you could rule that out, or B, you've come up with the problem. You have to ask questions. And so this is why one reason we're doing this today is to get you to start thinking. If I have a patient that has shortness of breath, we know what we should be seeing. Now, depending on how we ask and what we're told, it's going to lead us down another path. The lung sounds on asthma. What do we hear?
Wheezing?
Wheezing. When?
On exhalation.
So they're expiratory wheezes. Did you hear that music?
All you need to launch a culinary empire.
Yes.
Tools you claim everyone has in their kitchen.
Hey everyone, welcome to our video on lung sounds. This is a collection of lung sounds that we have in the library at our website, emtprep.com. We are excited to offer these to you, and we hope you enjoy.
So that's normal breath sounds. Air is flowing through normally. It's like a wind tunnel. You hear it okay?
Yes, sir.
All right. Remember what I said about crackles. It's fluid in the lungs. Go back. It's fluid in the lungs. So think about blowing air into a straw that's inside a glass of soda, water, Kool-Aid, whatever you want. Okay. So listen closely. So you remember that air going in that tunnel? So here's crackles. Coarse means they're really rough. You hear that bubbling?
Yes, sir.
They're not as rough. Still hear kind of bubbling noise? It's fainter, but you still hear the bubbling. What was longer, the inspiration or the expiration?
You play it again. You play it again.
Now, the other thing about that was you saw it was diminished. Did you notice the decrease in volume? You couldn't hear it very well. That's diminished lung sounds. They're not moving a lot of air through. All right, so here's the expiratory wheezing. Remember, it's more of a whistling sound. Well, it sounds like horny whale. Did you hear the prolonged expiration phase? Short in and long out. That's just the lung rubbing up against the pleural sac that surrounds it. There's an infection there, and so it's rubbing against the sac. That's what pleural rub is. It hurts. So that reminds me. So that's where the shortness of breath came first, because they'll have chest pain around the area where it hurts, where the infection is. And that's actually, this condition is called pleurisy. It's that infection around between the lung and the pleural sac. And it's causing that pleuritic rub. Should be more of a popping sound. A little of a popping sound. Where do you hear Strider? Where are you going to hear Strider?
The upper airway. The upper airway.
Yep. The throat. There's an obstruction there, and that's why it sounds like this. I won't worry about those. So what do you think is happening in the carbon dioxide level with the Strider? Going up. How well could they exhale?
Not that good. Not that good.
Not that good. Okay, so you heard the expiratory wheezes. So that's leading us down what path? Right?
Yes, sir. Yes, sir.
Okay. So how are we going to take care of asthma?
With the nebulizer.
Or
Their own inhaler.
yeah, their own meter dose inhaler. What the hell? Man, my computer's hating me right now. All right, what else? What else do we do for treatment?
Did somebody say nebulizer?
What was that?
Nebulizer?
We already said nebulizer. We already said the meter dose inhaler.
The discus or the one that's not for emergencies?
Huh? What did you say?
I'm trying to find the page. Hold on. Advair.
That's the patient's Advair. That's the patient's own inhaler.
Epi.
Huh? We can give epinephrine for asthma?
No, we can't.
Okay. How about oxygen? No oxygen? Okay.
Yes.
What do you do with the nebulizer?
Are you gonna withhold oxygen until you get the nebulizer ready?
Negatory.
Sure.
One thing about respiratory emergencies is that cyanosis, where they're starting to turn blue, is not going to be apparent right away. It's going to be a while before we notice it. So don't expect to see cyanosis early on. It's a late sign of respiratory distress. So when you show up and you see the patient is cyanotic, or in other words, their skin is blue, that means that they've been having a hard time breathing for quite a while. Okay. What the hell? Do way down there. All right. So oxygen assist with their meter dose inhaler, or you may be able to give them albuterol or nebulizer treatment. You have to be careful with the albuterol, because what are the side effects of albuterol?
Inches?
Huh?
Don't you get anxiety?
Anxiety?
Yes, sir.
Yes, sir.
Okay. Yes. What else?
Shakes.
Okay. The shakes. What else?
Does it raise your blood pressure?
It does a little bit, yeah.
It can mess with their airway too, can it? Like their nasal and throat.
No. Make it dry it out, but that's not really a big concern. What about elevated heart rate?
Yes, sir.
Yes, sir. Most definitely.
What the hell? Unplug my monitor. All right. What do we do for emphysema? So again, we show up and we see this. Barrel who, pursed lip breathing. Again, they might have an inhaler.
Wouldn't it be the same treatment as asthma?
Yes. Now, here's a question, because we said how emphysema is a type of COPD. So, the question to you guys, especially to like Steve, can we give them high flow O2?
No.
Why not?
Because they have a high hypoxic drive, not a hypercarbonic drive.
Carbonic.
Carbonic drive.
No, it's carbonic drive.
Carbonic drive, sorry.
Okay. And so too much O2 can shut down the respiratory drive, correct?
Yes.
Okay.
Yeah.
Do you guys concur? Okay. However, with a patient, COPD patient, that we go on, we can give them high flow O2. I know a lot of people say, no, don't do it, you're going to kill them. Yeah, you can, but here's the difference. It takes several hours. The amount of time that we have them under our care is not significant enough or long enough to cause any damage to them. Once we get them to the hospital, the doctor will start titrating their FiO2. So it doesn't shut down the respiratory drive. So we'll treat the COPD patient, because again, emphysema is a type of COPD. They categorize it as COPD, but they still have emphysema. We're going to treat them like any other respiratory patient. They're having a hard time breathing. We're going to give them oxygen. Simple as that. Okay. I know, and believe me, I was taught the same thing years ago, that if you give a COPD patient too much oxygen, you can knock out their respiratory drive. But it's okay to do it because we don't have them for that long. Okay. All right. Chronic bronchitis, what do you think?
They get some oxygen.
Okay. What else? Anything else? How about albuterol? Don't we have wheezes?
Yes, sir. Yes, sir.
Yeah. Productive cough? So maybe giving him some albuterol to help loosen up the gunk in the bronchioles? Yeah. Oh. Wait. Oh, this is cardiac emergency. Okay. I was like, damn, we missed one. What else? Ooh, AMS diabetes. Well, guess what we're gonna do coming up? We got several more to do. Not today though. Wednesday we'll do this one. So be prepared for Wednesday. Hey, look, we already did CHF. So what do you do for CHF? Oh, we forgot a very important one on CHF.
We'll give oxygen too, right, sir?
Uh-huh. And then set them up.
Yes, sir. Yes, sir.
And that's about it. We can't give them nitro for CHF. We can't give them Lasix. We can't give them morphine. So we can give them oxygen and set them up. What about pneumonia? What can we do for pneumonia?
Albuterol, oxygen.
What can I give albuterol for pneumonia?
No, because those are bronchi. Never mind.
Yeah, typically we don't give them albuterol for pneumonia. Really not much. Maybe some O2. It's infection. They need antibiotics.
CPAP or BiPAP?
Oh, I forgot about CPAP from, we can do CPAP on all these. Actually, I don't know about pneumonia though.
Wouldn't it work? I don't know.
It'll work with the others. Pneumonia, I'm not sure.
If they have their antibiotics on them, are we allowed to keep giving them their antibiotics?
No.
I mean, would that help relieve in that moment, or not really? We're just taking it.
No.
We're just taking it.
No, it's not going to be in the moment. And if they've already been treated, then they should be taking their antibiotics. So, if not, that's on them. And remember, pneumonia used to kill. Back in the 19th century, people had pneumonia, they could die from it. So, okay. I went over your quiz, and we've pretty much covered all of it. Now, there was one. Well, I shouldn't have said that. You know how to do that, hopefully. Ooh. For one question, I hope you guys remember the causes of shock, because we talked about this particular question. Not fully. But what I do want to cover, another type of respiratory emergency. The patient might experience chest pain. They might be experiencing anxiety. However, that anxiety, have you ever been so upset with a significant other where you just maybe had a panic attack, anxiety attack? You were breathing so hard and heavy because they just pissed you off to no end. Are you looking at the guilty party there, Miss Hannah? Or are you pleading the fifth?
I plead the fifth.
Ah. And that aggravation just making you breathe like crazy, right? Well, breathing rapidly can cause you to blow off too much carbon dioxide. And that's what hyperventilation syndrome is, where you're breathing too fast, but you're blowing off too much carbon dioxide. And so, and this kind of goes with the discussion on Wednesday, cardiac emergencies. What you normally hear, or what you normally hear of, is older guy, 50s, 60s, 70s, 80s, complaining of chest pain. They're usually slightly or very overweight or overweight, whatever stage there. With that chest pain, it's a good possibility that they're having a heart attack. Women, on the other hand, they're such delicate creatures, and they are a conundrum that they have to make things, I will say, interesting so I don't get any daggers thrown at me. And what I mean with that is, that women don't present the same way as guys when they're having a heart attack. They might not feel any chest pain. A lot of women present with the feeling of being tired, worn down. We call it a feeling of malaise, feeling sick. Maybe a little bit of difficulty breathing, but for the most part, more run down. So it's not like, oh, here it comes, I'm having the big one. No, it's not that. The other thing is that once a month, you ladies get an oil change. That's the way it was described to me when I was in paramedic school. It's like getting an oil change once a month. So women of childbearing age, so that's all you ladies in here. If you were to tell me that you're having chest pain, I would not be thinking that you're having a heart attack. I mean, you got to weigh 300, 400, 500 pounds for me to think that you're having a heart attack. And none of you are anywhere near that. Okay? So now what I'm telling you is based on my experience. All the years of being in EMS, when a female patient is telling me that they're having chest pain, I don't think it's a heart attack. I think it's an anxiety attack, because that can cause chest pain. Okay? So just remember that. If women are complaining of chest pain, the odds are very good they're not having a heart attack. So you want to find out, is there any emotional activity? In other words, did they get upset about something or with someone? And so as somebody that's waiting for her attorney to get there mentioned, if she's going through that emotion right now, and I'm not saying in real life, I'm saying in this situation, in this scenario, let's say she's going through that situation right now. Do you think that having that stressor there is actually of any benefit? Or it would be more beneficial to get that individual away from them, to be able to have a chance to relax.
Yes.
Yeah. So you want to remove that stressor. Now, the way I'm tying it in with the respiratory emergencies is, remember, they're breathing too fast. They're blowing off too much CO2. And so we give them a paper bag, right? Yeah, we don't give them paper bags anymore.
I was told not to.
Yeah. I was being facetious and I was seeing if you guys were paying attention. That's what we used to do years and years and years ago. We used to give them paper bags. We don't do that anymore. We want to try and calm down their breathing. That's why we want to get the stressor away from them. The other thing too is when we are doing our assessment. So again, let's say it's Candace. Candace is our patient. And she says, "Oh, my chest hurts." Okay. Again, looking at Candace, I'm not suspecting a heart attack. So I'd ask her, anything upset you today? Did you get in a fight with your husband or boyfriend or both? Did you go through anything emotional today? And she'd say, let's say she says yes. Okay. And so we count her respiratory rate, and her respiratory rate is 28. Okay, so far, so good, right? An emotional stressor, she's breathing fast. So what can we ask to reinforce or to confirm our suspicion that she's hyperventilating? Numbness or tingling around the mouth, also in the feet or the hands. And the other thing that we might see in that situation is what we call carpal pedal spasms. In other words, what happens is that our hands and our feet curl up. So you'll see their hands kind of, you'll see them all curled up, or they could be, well, let's see. See what I can find for all y'all. Oh, here we go. You see that tightness?
হাত সোজা করা যায় না, সোজা করে রাখেন, হ্যাঁ, দেখ কি হয়। Carpopedal spasm. This is called carpopedal spasm.
You see how even though he was able to extend her hand, it went back to that spasm? I couldn't understand a thing they said. Did you? Oh, here's another one. Ooh, young female. No comment. Dr. Ray.
হাতের টিপিক্যাল পজিশন ছেড়ে দাও, এটা যে হাতের স্যারকে শুনে না, ওটা নাকি রিবেদিং মাছ পাওয়া যায়, কিছুই লাগবে না স্যার। এটা যদি আমরা ওই যে ফেস মাস্ক দিয়ে যদি স্যার 2 লিটার 3 লিটার দেই, একই রিটেনশন হয়ে থাকে। এটা টিপিক্যাল একটু কনফ্লিক্ট শেষ ওষুধ খেতে তাহলে কয়টা আমাদের আসে তোমাদের আসে কত কত খেতে আমরা সেকেন্ড পার্টে আসে 5/25 আমার সেকেন্ড পার্টের জন্য খুব গুরুত্বপূর্ণ জিনিস এটা টিপিক্যাল ফিচার একেবারে
So, carpal pedal spasm. If you ever get a chance to go to paramedic school, go for it. I had a patient one time, or I've had several, but I remember the last one. She was having a major panic attack. And the cool thing about being a paramedic and out there was I could give her some medicines to calm her down. So I got to get the Haldol or the midazolam. I think the Haldol. Actually, yeah, the Haldol, because I hated dealing with narcs. Drew it up, gave her an IM shot in the shoulder. About 10 minutes later, because she was tightened up like that. She had that carpal spasms and breathing really fast. Gave her the medicine, and guess what? Everything calmed down. Just knocked her the flock out and relaxed those spasms. So, but at the EMT level, all we could do is try to talk them down. Trying to get that stressor out, get them to kind of forget what's going on. Okay. So hyperventilation, the carpal pedal spasms, numbness and tingling around the mouth. Okay. Any questions? No? Did you like this worksheet or no?
Yes, sir.
Are you going to be ready for Wednesday for cardiac emergencies? Like my dad used to say, no se oye.
No, sir.
The no se oye means you don't hear me. So it's like, la, 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 no comment type of thing. All right. It's not going to be tomorrow. I got a full day tomorrow. But Wednesday, I'm going to start sending some emails. If you don't get an email from me, that's a good thing. Because we're starting to back up on quizzes and exams. And if you stay behind, it's going to be hard to catch up. Okay. So, I'll be sending those out on Wednesday. Okay. So if you already know you owe me stuff, let's get it done. Okay. And like I said, Sunday, we're going to have another tutoring session. It was kind of I wouldn't say a free for all, but it was just basically whatever people wanted to go over. So if we have to go back to chapter 3, we'll go back to chapter 3. If you want to go over chapter 14 or 16, we'll go over chapter 16. We went over pathophys, chapter 8. We were on it for a while. We went over shock, chapter 15. I forget what else we went over. But yeah, we were together 3 hours, almost 3 hours. And there was no time limit, so I was a lot slower. And it was different than the way these lectures are done, right? Yeah, because here I keep looking at the time to see, how much time I have and to stop for a break and everything. And there I didn't. So the other thing too, I heard from somebody, and I don't think it was from this class though, but I heard that sometimes they're not able to keep up because I talk too fast. And I tend to do that. And I just tend to talk and talk and talk. If you want me to slow down, tell me, slow down. If you want me to go over something else or something, if you want me to go over something again, I will go over it again. I don't want to leave anybody in the dust. When I don't hear from anybody, that's telling me that you guys are catching on, although the quiet says a lot, but I want to hear from you guys. This is your class. You tell me what you want. You tell me. I'm your facilitator. I'm here to make it come alive. You read the chapter, you come to class, we discuss it. We facilitate discussion. Okay. I really want you guys to be able to put two and two together. Because if you've ever noticed, and for some of you that are working at life, have you seen some of the stuff that we've talked about and how it actually is out there? Did it help make it click? You're like, oh, that's why that is going on, or oh, this is what we see. Okay. So I'm trying to help you bridge that gap to say, this is how they present. That's what I like about those videos, the Real DX videos, is there's that little old lady. You could hear her having a hard time breathing. You could see the pedal edema. And the other one, I just took Lasix. It makes it come alive for you. So you guys tell me what you want. If you want me to do PowerPoints every single day, I will do PowerPoints every single day. That's not a good way to learn, especially since you have the PowerPoints in my Brady lab. I mean, I could just record my lectures. Well, I do, but just do a blanket recording and just assign them to you. And you have to listen to the recordings. I used to do that long time ago when I was at the college. Actually, I started doing it at the paramedic program too, but I didn't like it. Questions? I'm being shy.
How much is paramedic school?
How much?
$5,000?
It all depends where you go. Lives used to be $32.50, but they raised it, so probably closer to $4. If you go to EPCC, you're talking about 2 years. Oh, I don't like you now. If you're talking about EPCC, you're talking about 2 years of college. The reason I don't like them is firefighters get discounted pricing or free tuition at the colleges.
Mm-hmm.
Yeah, shut up.
Mm-hmm.
I don't know why firefighters get a discount. They could flip and afford it. Why can't it be EMTs? And they passed a law the last legislative session. No, not this last one. The one before, the 2018 one, where licensed paramedics now can also get free college tuition. Yet in the state of Texas, you have to have a college degree to be a licensed paramedic. So who in their infinite wisdom thought of that is beyond me. I think that's a crock of you know what. So write your representatives, your state representatives, and tell them to change it. Include EMTs in there. How else are you going to get ahead without a college education? I'm telling you that right now. Go to college, get a degree. It's going to open up a lot more doors. Trust me. I know, I have my degree, or one of my degrees. I'll shut up now. Oh, I've turned off my phone. You guys ready to call it a night? Or do you want to stay with me till tomorrow morning at 8 o'clock?
No, sir.
No,
I'm
I'm no
reading.
fun or what?
It's late and it's Monday.
Yeah, it's been Monday since like midnight last night. I was up to 1 a.m. All right, guys. So quiz on Wednesday, lecture, and that's it. All right, anything else?
Yes, sir.
All righty. Then I will see you guys Wednesday. Yeah, have a good night.
Thank you.
Have a good night, everyone.
All right, good night, Lou.
Good night.